Hey everybody, this is Dr. Larson. I'm just going to show you a video today to demonstrate a trochanteric bursectomy, and we're going to do this arthroscopically. So first things first, we're going to start out here just underneath the skin, working on the iliotibial band. We've got my cautery probe here, and I'm going to use that to actually do the incision through the IT band and actually do most of our trochanteric bursectomy with it. And right there you can see where we just pop right through the IT band, and now I'm into the bursa underneath it. So let's just stop here and take a look at everything. We got our IT band here. This is the white shiny material. Our skin is up above us, that white fascial bands and the yellow fat, and then my black cautery probe here working its way through the tissue. So anyway, you can see that gap underneath the IT band there. That is the bursa. That's the space between the IT band and the muscles and bone underneath it. In this case, we're working right around the hip. For those of you who don't know where the IT band is, I'm assuming if you found this video, you were looking for the IT band and you're looking for a trochanteric bursectomy. If you're having trochanteric pain, what I'm going to show you here is the tissue that builds up in the trochanteric bursa. So this is all the stuff that's directly underneath the IT band. We're going to see some muscle here at the very tip top as we get through this. That is the Tensor fascia lata. It is a muscle that helps to keep tone on the IT band. That's the pink fibers we're seeing just directly underneath. We don't want to get too far into there. We don't want to denervate anything. We don't want to cut any of the nerves or arteries that are supplying that muscle. So we're just going to expose it and then move on. So now we're down here into the actual trochanteric bursa, and you're not seeing much of a gap here. That's because this patient has pretty severe trochanteric bursitis, and that's characterized by all this thick garbage that's built up here. You can see down in the very bottom there's that gap. That's what your bursa should look like. A bursa shouldn't be all this connective tissue. A bursa should be a nice empty space that allows two different materials, two different tissues within your body to move separately and independently from each other. But when they're all stuck down like this, they can't do that. It causes a lot of pain. It causes decreases in your mobility, makes it hard to function, makes it hard to live and sleep in a lot of cases. And then we just took a little jump there. We took out the cautery probe and we put in a shaver probe. Now, the cautery was getting a little aggressive. We are actually getting into some of this other pink material here down below. The stuff deep to my probe right now is actually the Gluteus Medius. That's the muscle that attaches to the top of the femur. The trochanter is the bump on the side of your femur that you can feel right on the outer side of your hip. So we're not actually in the hip joint here. We're outside of it, separated by several layers of muscle from the actual hip joint. But when we're working around a muscle belly like this, I find the shaver tends to work better to pick away these thin wisps of fascial adhesions without actually damaging the muscle. And we just had like a little earthquake there. That's actually, I'm going to show you back again. We're going to reverse it. All that's happening here is I'm rotating the leg. And so you can actually see the femur and the trochanter and all the muscles attached to it slide underneath me simply as I rotate the leg. Now that's what those fascial adhesions are preventing from happening usually. You're not able to turn that with all those thick adhesions that we had before. If you try and turn it, everything's stuck together and you're pulling and tugging on all those adhesions. It doesn't feel good and it really limits your mobility. And as we're just going to continue to finish taking out all these adhesions, I'm just going to speed up the playback on the video here a little bit so we can get through the complete removal of the adhesions. Underneath all of this, you can see the lines of the lateral quadriceps muscle here, the vastus lateralis. That's the shiny fibers that you see directly underneath us. There's some blood vessels here. They're very, very tiny. These are just capillaries. Nothing major. We're going to get in here and cauterize them. A lot of these are just simply indicative of the inflammation that's been going on and neovascularization or growth of new blood vessels that occurs in an inflamed and irritated area. So no major harm in just cauterizing these and preventing them from bleeding, preventing further problems. Now, as I move it back and forth here, I'm looking back underneath the posterior part of the IT band. It's still pretty tight. It's kind of rubbing on the IT band. I can't see very well underneath it, but I'm going to clear it all out here. The dangerous part is that we're actually getting into the sciatic nerve territory here. All that fat Underneath there, actually, the yellow stuff, the fat actually protects the sciatic nerve down deep below this. It's a couple centimeters away still, but if you're not cautious, you can get all the way back in there. At the very bottom of the screen, near the base, you can see, well, I guess up near the top of the screen there actually, you can see the gluteal sling, which is the bottom of the gluteus maximus. We'll come back to it in just a moment. I like the shot overall though. You can see that we've got everything nicely loosened up. It's moving smoothly and freely. We don't really have any significant adhesive tissue here. We've got the IT band separated, but as you can see there, it's pretty tense and pretty tight. So I'm actually going to make a little crisscross cut in it. I'm going to move the other tissue out of the way so I can get to it. And we're just going to transversely cut through the IT band here to loosen it up even further. Most of this IT band will grow back. It's important that we get people into physical therapy directly after this procedure so that they continue to stretch it out. We want them to keep it nice and loose. The more they stretch it afterwards, the less chance they have of this recurring and becoming a problem in the future again. Overall, this is a very good procedure. It does have some risk of the problem recurring, so we do want to keep people on an active and healthy lifestyle after this to make sure it doesn't. We're just speeding through the cauterization phase here. We're going to split through the front of the IT band as well and really loosen this all up. Overall, most patients who go through this procedure have been having pain somewhere between a 7 and a 9 out of 10. We generally take them down somewhere between a 1 and a 3 out of 10. Some people get complete relief. Anyway, if you'd like to see more videos, just follow my channel. If you'd like to actually see me for medical problems, you can find my practice's address in the description below. And if you want to find out more about healthy fitness and living, go ahead and check me out at larsonsportsortho.com as well. Thanks. We'll see you next time.